Hello, I'm Dr. Brandon Witt, and in this video we are going to go over the time between conception and birth. We'll go step by step and see what takes place inside the womb over the course of 9 months. So, grab your popcorn and enjoy. There are a couple things we need for starters, those being fertilization and implantation. Fertilization is the action or process of fertilizing an egg, and it involves the fusion of male and female gametes to form a zygote. In other words, the sperm meets the egg. We'll take you step by step on how this will occur. First off, we will need ejaculation of semen into the vagina. The sperm heads towards the ovum by moving through the cervix to the uterus through the oviducts or fallopian tubes to reach the ovum. The sperm starts to produce enzymes to disperse the follicle cells surrounding the ovum, and then only one sperm separates the ovum's membrane, and the male gamete's nucleus fuses with the female gamete nucleus, forming the zygote, which is the fertilized ovum. Then the ovum produces a protective membrane to prevent the entry of any other sperm. Next, we'll need implantation. Implantation is the blastocyte must become implanted in the wall of the uterus if the pregnation is going to continue. Implantation occurs in the inner lining of the uterus, called the endometrium. The endometrium is rich in blood vessels and nourishes the fetus as it grows during the 9-month pregnancy. We will start with the first trimester, which is the first 3 months. We will take you month by month to see what occurs inside the womb. In the first month, the amniotic sac, which is watertight sac that forms around the fertilized egg. It helps cushion the growing embryo throughout the 9-month pregnancy period. In the first month, the placenta also develops. The placenta is a round, flat organ that transfers nutrients from the mother to the baby. It also transfers waste from the baby. By the end of the first month, the baby will be around 6 to 7 millimeters, which is about 1/4 of an inch long. Move on to the second month. This is where the baby develops. In the second month, your baby's facial features continue to develop. The ears begin as a little fold of skin at the side of the head. Small buds that eventually grow into arms and legs are forming. Fingers, toes, and ears are also forming in the second month. The brain, spinal cord, and other neural tissue of the central nervous system are well formed. The digestive tract and sensory organs begin to develop as well. Bone starts to replace cartilage. The embryo begins to move, although the mother cannot yet feel it. After month 1 and 2 are completed, we move on to month 3. When the 3rd month of pregnancy comes to an end, the baby is fully formed. It has arms, hands, fingers, feet, and toes, and can open and close its fist and mouth. Fingernails and toenails are beginning to be developed, and the external ears are formed. The beginning of teeth are forming. The baby's reproductive organs also develop, but the baby's gender is difficult to distinguish on the ultrasound. The circulatory and urinary systems are working, and the liver produces bile. By the end of the 3rd month, the baby is anywhere between 7.6 to 10 centimeters, which is about 3 to 4 inches long, and weighs about 28 grams, which is approximately 1 ounce.
By the 4th month, the fetus is developing his hearing. His bones are hardening, hair will start to sprout out of the scalp. The legs and arms have become the right proportion to its body. Sensory development is starting in the fetus's brain, and the fetus's blood vessels are visible through his skin. By the 5th month, the fetus's eyelids are fully developed. Its skin will be wrinkled till it grows into it. Eyelids are still fused shut, but the eyes are fully developed. The baby starts to develop taste buds. The baby's lungs are just starting to develop. By the 6th month, your baby will start to put on some weight and fat. Its hair is now a recognizable color and texture. Your baby's genitals will change determining on its sex. It will start to suck on its fingers. The baby's eyes will be able to open. Your baby's head is starting to grow bigger to accommodate its brain. Your baby is receiving around 200 milligrams of calcium each day, growing bigger.
Next, we will begin the third trimester. We will start at month 7. Towards the end of month 7 of a pregnancy, fat begins to be deposited on the baby. Your baby is about 36 centimeters or 14 inches long and weighs about 2 to 4 pounds. His hearing is fully developed and changes position often and is responsive to the sound, pain, and light. Could still survive if born during this month. Now we will move on to the 8th month. Now your baby is approximately 18 inches long and weighs about 5 pounds. The baby continues body development and fat reserves. The baby begins to kick more often. Its brain is developing rapidly, and the baby is able to see and hear. Most internal systems are well developed, but lungs still may not be fully mature. Ladies and gentlemen, we have made it to the 9th and final month. In the 9th month, your baby is still growing and maturing. Their lungs are almost fully developed, and reflexes are no coordination, so they can blink, turn their head, grasp, and respond to many different things. The baby changes position to prepare itself for delivery. It drops down towards the pelvis, and the head usually faces the birth canal. By the end of pregnancy, your baby should be around 18 to 20 inches long and weigh anywhere from 7 to 9 pounds. Well, there you have it, folks. Dr. Michael Steele and I broke down the 9 months of pregnancy.
We broke it down month by month to show you in full how a baby develops.
I hope you enjoyed our presentation.